In a transformative era, when reimbursement models reward quality improvements in medicine, Christiana Care is well positioned to offer the highest standard of care backed by the evaluative science the Value Institute brings to clinical practice. The latest innovation work of the Value Institute was unveiled during the Value Institute Spring Symposium in June of 2016. More than 200 participants gathered to learn about the success of the Value Institute, which has only been in existence for 5 years, but is already influencing the direction of healthcare throughout the nation. Participants learned about the Value Institute's key research, with findings that improved clinical outcomes for patients, and saw how robust collaborations between researchers and clinicians yield important findings in the field of healthcare delivery science. The symposium was led by Dr. Tim Gardner and Dr. Eric Jackson.
Today was a great example of a symposium where not only did we inform the audience of activities and important projects in the institution, but there were a lot of new things for new concepts for people. Great opportunity to inform and teach.
We have a very large portfolio of work. We have a very robust, heterogeneous collection of investigators and collaborators to accomplish this work.
Value Institute researchers, in partnership with Christiana Care clinicians and community members, shared their work in 6 projects. These 6 projects help accelerate Christiana Care's journey toward achieving medicine's triple aim, which is improving population health and the experience of healthcare while reducing the cost of care. The featured project includes the Value Institute's work in investigating several key quality of care issues that impact the patients and populations Christiana Care serves. It took a unique collaboration between researchers, clinicians, and legal professionals to understand the social factors that influence a person's health and to offer meaningful help. The medical-legal partnership helps improve the social needs of patients and is the first funded program through the Value Institute Harrington Community Partnership Fund.
Patients with unmet legal needs and other social determinants of health often have stresses in their lives where they can't address their health care issues. Having an attorney help them resolve some of those issues gives them an opportunity to take better attention to their own health care.
Embedding a hospitalist is common practice on medical units, but almost unheard of on trauma teams. Yet that's what the Value Institute researchers and Christiana Care's trauma service proposed and implemented, improving both the mortality and readmission rates.
Well, just like embedding a hospitalist on our trauma team, we had a member of the Value Institute embedded in our research program. The Value Institute basically wrote the manuscript that we submitted to the Journal of Trauma, and I'm happy to say that that will be published in probably next month.
Medications and medication compliance make a difference in the recovery from a health condition and in quality of life when living with a chronic condition. So why do some patients decide not to fill their scripts? Value Institute researchers analyzed pharmaceutical claims, which shed insights into the needs of pharmacy patients.
It's really difficult to study primary non-adherence. It wasn't until recently that prescription pharmacy claims could be linked with electronic prescriptions. Only a few years ago, all prescriptions were pretty much paper. So now that everything is electronic, we're able to link the prescription with the claim and really see which medications are being filled by our patients.
Infections are a serious concern to every hospital. Addressing how to reduce and eliminate infections, employees in Christiana Care's Medical Intensive Care Unit partnered with a Value Institute expert on human factors to leverage the Comprehensive Unit-Based Safety Program, or CUSP, which led to large reductions in infection rates.
2 ICU saw improvements not just in central line associated bloodstream infections, but also in things like device utilization, reduction in falls, improved hand hygiene compliance, and the reduction of pressure ulcers. And these have been elusive goals for hospitals for a long time.
Patients want a team that works well together. Having access to something like the Value Institute has helped our team put forth our efforts because we have somebody to work with that we like working with, that is helping us do our outcomes and our goals.
When it comes to assessing a patient's condition, vital signs alone may not portray an accurate picture of a patient whose condition is in decline. Value Institute researchers, in partnership with Christiana Care's Department of Quality, Patient Safety, and Population Health, developed the ChristianaCare early warning system that steps beyond the traditional monitoring of vital signs by clinical staff.
We are targeting optimal health by identifying early signals of deterioration and standardizing care. And we are also targeting exceptional experience by reducing the variation in the care that we deliver to our patients.
The early warning system combines both the nurse's key observation of patients' clinical systems with the vital signs in the hospital's electronic records to proactively flag patients who are deteriorating physiologically, helping clinical workers respond sooner and better while keeping patients safer.
Additionally, it's going to be a system to support communication between the multidisciplinary team taking care of a patient so that everyone is on the same page and speaking the same language when they're discussing a patient.
Patients with chronic kidney disease face a higher likelihood of hospital admission. This led Value Institute physician researcher Claudine Jerkovitz to create a chronic kidney disease registry. The registry leverages data from electronic records to ultimately predict hospital admissions for those with kidney disease.
We want to predict admissions to the hospital, not readmission. Many programs, many health systems in the country are focusing on readmissions. What we want to do is to go in the community and work with primary care physicians, nephrologists, with physicians who practice in the community and help them improve the care of the patients.
In a relatively short period of time, the Value Institute has published hundreds of research papers, has received numerous national awards and prestigious recognitions, and has forged robust clinical research partnerships.
The symposium today was really a way to demonstrate and show the breadth and extensiveness of the work and the quality of the work.
The patient focus is clearly within our sights, and it's our mandate. We want to learn. We recognize that there's new knowledge emerging on a daily basis, and therefore by having these strategic partnerships enables us to learn from the expertise and insights of others.